Today represents a 6-month follow-up to our initial press conference regarding, at that time, was a spike in our fire deaths. But since then, as Amy has reported, we went from 3 to now 11 in 8 particular incidents. We thought that this week was timely to come back to the community to talk with you regarding what we can do as partners to assist you, the public, in helping you with creating a fire-safe environment. As Amy has mentioned, joining me today is the city's Fire Marshal, Battalion Chief Earl Dyer. And so I'm going to briefly go over not only our Richmond statistics, but also national and state statistics, and then begin to frame what has occurred, our response and our ongoing response, and then hand it over to Battalion Chief Earl Dyer to get into the specifics of the cases, if needed, as well as the efforts from his office and our fire department at large. This is National Fire Prevention Week, which occurs on the first weekend of the month of October. National Fire Prevention Week was championed by President Calvin Coolidge because of the Great Chicago Fire in 1871. And since then, it's been a national proclamation in 1925 that is recognized by the United States and Canada. And this is a national proclamation, and so we just think it's very important that we highlight this and that we bring it to the consciousness of our community, not only in the city of Richmond and to the region, because the region itself has also seen its share of fire fatalities. So Sunday, October the 3rd, was the kickoff for National Fire Prevention Week, and it ends this Saturday on October the 9th. Fire loss in the U.S. in 2020, local fire departments responded to an estimated 1.4 million fires. These fires caused 3,500 civilian fire deaths and an estimated 15,200 reported civilian fire injuries. Property damage was estimated to be at $21.9 billion. That said, on average, a fire department responds to a fire every 23 seconds in 2020 in the United States and Canada. A home structure fire was reported every 89 seconds, and a home fire death occurred every 3 hours and 24 minutes. A home fire injury occurred every 46 minutes, and 74% of all fire deaths were caused by fires in the homes. These statistics that I'll read to you are coming from the National Fire Protection Association, the NFPA. It's their fire loss in the United States research from 2020. Let's focus this now on narrowing our scope to Richmond and the state. Thus far, currently, the state of Virginia has 48 reported fire fatalities in Virginia from January 1 of this year to October 1 of this year. Here in Richmond, we have 11 fire fatalities in the city of Richmond during the same period. That is a number we certainly, as the fire department of the city, we're not proud of that number. We are embedded in our community partners, and it is our role, it is our sole role to ensure that our citizens are educated and we help them to promote fire safety within their homes, their families, and in their communities. So we're doing what we can and partnering with the community, and we're open 24 hours a day, as I'm sure everyone knows, to assist the community out of 20 firefighting sites throughout the city. We've recorded nearly a quarter of those 48 deaths. The city of Richmond has recorded nearly 25% of the fire deaths in Virginia. As Chief Dyer will echo these sentiments, one death in the city of Richmond, in the state, or anywhere, is one death too many that's caused by fire. The map behind me illustrates the locations as well as the dates of the 11 events, the 11 fire fatalities that occurred in Richmond. The first 6 are individual events, and the last 2, in August the 15th and then 2 weeks later, on August the 31st, were multiple events. 3 on Banton Street and 2, a husband and wife, on Vinton Street. As you can see, from my standpoint as the fire chief, this is definitely unacceptable. And again, as your fire chief and as the Richmond City Fire Department, we're doing all that we can do to assist, partner with, to help make our city a more fire-safe city. Also behind me, just to give you a little bit more breakdown of the families that were impacted behind this so that you can actually see, put real faces to these events. Oftentimes when you hear fires, you don't really know who was involved. the ages of the people involved. You may hear it, but you not hear it. But we decided to reach out to the family and to make this very real. Your loved ones, our community members that have perished in 2021 because of a fire, something that's totally preventable in the world in 2021, a residential home fire. In January on Baronet Drive, some of the commonalities, a 77-year-old male. In March on West 34th Street, a 75-year-old woman. In March, 6 days later, on Royal Avenue, a 57-year-old male. In April, on Fifth Avenue, a 45-year-old woman. In April again, on Delaware Avenue, a 75-year-old male. In June, on North 21st Street, a 68-year-old male. In August, as has been previously mentioned, 2 females and a male, ages 22, 4, and 9 months. And again in August, on Vinton Street, a a woman and a male, both ages 84 years old, husband and wife. And so we obviously do not take these fire fatalities lightly. And again, it shouldn't happen in our city or anybody's community. So we all have to do our part to make sure that we're here to prevent fires and to create a more fire-safe community. Commonalities, definitely the age of our victims, whether it's our seniors or our older population or our younger population, they both fall into those greatest at risk for fires. Smoke alarm issues. 6 out of the 8 residents did not have a working, properly functioning smoke alarm. The fire department gives away smoke alarms. They're free. A device that can save your life is free to you, the citizens of Richmond. I repeat that, free to the citizens of Richmond. Not only will we give you a smoke detector to save your life, we will install a smoke detector to save your life. We'll do this at your request. We'll do it when we're visiting your homes on different calls. That is our mission, to help you help yourself to save your life. Again, these smoke detectors are free and at no cost or charge to the individuals. As I've mentioned earlier, the ages of the victims fall within the high-risk categories, and some of the living conditions of our victims where we discovered evidence of hoarding conditions. Obviously, if you cannot escape your home when it is on fire, then that presents a challenge for you to get out. It presents a challenge for us as first responders to get in, to get you out. And the causes of fire are the leading causes: smoking and improperly discarded smoking materials. So very common factors, not only here in our city, in our region, in our state, but definitely the common factors that you find around the country. So with that, I will turn it over to the Chief Fire Marshal Official for the City of Richmond, Battalion Chief Earl Dyer.
Thank you. Good morning. So I'd like to first thank you for giving us this opportunity to reach out to the community as they are one of our greatest resources. So I want to start out with a brief statement, and it does echo a little bit about what Chief Carter talked about earlier. One life lost is one life too many. 11 lives have been lost in the last 8 months, and these deaths are unacceptable. However, like these, the vast majority of fires are preventable. There are often several commonalities. Most of these events involve a lack of present or working smoke alarm, excessive clutter, improperly discarded smoke material, overloaded circuits, no escape plans, and individuals with limited mobility. So be sure to look after your friends and family. These are all things that we talk about in efforts to educate the public and our communities. So your fire department comes before you today to make this heartfelt plea. Please install working smoke alarms. Do not smoke in bed. Do not overload your electrical outlets, and remove some clutter. The fire department has a smoke alarm program that has been in effect for years. So please call us if you need help installing a new smoke alarm or testing a current alarm, or if you have any questions about anything that I've mentioned previously. What are we doing to help decrease the number of fatalities? We are hosting several upcoming community engagements, both virtual and in person. We're installing smoke alarms and canvassing the neighborhoods. We're also working with the local media outlets to spread information. The caveat to this is that we cannot do this alone. The greater burden falls on you, the public, to be more vigilant, to be more aware of your surroundings, and for you to protect those you love. Having a working smoke alarm is a small price to pay for your life. These fire deaths are faces, as we've shown earlier. So we really wanted to put those faces with the events that have taken place across our community over the last 8 months. It is certainly something that we haven't experienced in a very, very long time. And so with the increasing, the temperatures changing and things of that nature, we just want to bring the community together to let them know that we are concerned about their safety and health as we move throughout the remainder of this year. So as Chief Carter mentioned briefly, I'd like to add a few other statistics just briefly. Across the country, fires are down by about 3%. By the same token, there's an increase in fire deaths by about 24%. So you see there, we're safe on one hand, but there are some things that we're not doing on the other hand to save our community. So we're working to try to change some of those. This is one of our things that we talk about to the community. This is still relevant. I think the Chief and I both have talked about that and the things that people can do to keep their community, themselves, and their families safe. And so as you see, this is just us being out in the community, talking to those individuals, trying to make them aware of what's taking place in their communities. We do have a program that's unfortunately that we do have to canvass neighborhoods to bring that awareness even closer to home when we do have a fire death in those neighborhoods. One thing that I'd also like to mention is that the vast majority of our persons or people in our city that dies not from being burned, it's actually from smoke inhalation. And so with that, a lot of those people become lethargic and things of that nature, which enables them to get out of the house, which is why we encourage the public to have a working smoke alarm and to also have a fire escape plan so that it limits them or give them the ability to try to remain calm as they try to egress from their home. And so these are just some of the informational sheets that you're going to see surfacing throughout the city. From our office, we're actually having them put on buses and things of that nature. So fire prevention for us is not just the week itself. The week itself is just a heightened awareness of the things that we want the public to understand. But for us, Fire Prevention Week or fire prevention in itself is a day-to-day battle for us in trying to find ways to keep the city, the community, and our visitors safe.